Hello, my name is Dr. Kenneth Abbott,
Hi, my name is Arthi Patel.
and we would like to introduce the Calvert Health Oncology program to our community and provide some basic overall structure and talk about the components of this program, as well as the collaboration with Duke that has been in place now for over 2 years. And then spend a little bit of time talking about a subject that is important to both Dr. Patel and me, that is cancer survivor in general, with emphasis on breast cancer survivor.
I'm really looking forward to sharing some information with our community, and I appreciate the opportunity to spend some time with you today.
Oh, likewise. Always very pleasant. If you were to describe to the average member of the greater Southern Maryland community how our program is structured here at Calvert Health, what would you say?
So the foundation of our cancer care program is built on our multidisciplinary comprehensive medical oncology team. So we start with 3 board-certified medical oncologists, all of whom are very well versed in caring for all cancers and hematology malignancies in the community. We also work closely in collaboration with our other board-certified physicians, such as radiology, pulmonology, surgery, radiation oncology, and also some of our subspecialties such as pulmonology, cardiology, and gastroenterology, for instance. So we work closely as a team. We meet weekly or every other week to sit down and discuss cases, both new cases as well as established patients. And with our team and in conjunction with our evidence-based guidelines, we put together treatment plans that are state-of-the-art, patient-centered, and per guideline recommendations.
What you're referring to is our program of multidisciplinary tumor boards. How many of those do we have right now?
Currently, we have 3 separate tumor boards. We meet weekly for our breast oncology tumor board, every other week for thoracic oncology, and then once a month for our general oncology subspecialties.
I find participation in those tumor boards to be not just valuable for helping to make a consensus determination on the best ways of handling specific cases, but also for enhancing communication amongst the various members of the team, which goes forward to helping to make sure that care is rendered in as comprehensive and as efficient a manner as possible. But it's also hugely educational as well, too. I don't think there's a single tumor board that goes by where I don't learn something new.
And we all learn from each other. You bring up a very good point. Caring for the oncology patient really does require a team, and we're super fortunate to have so many different ancillary services that participate actively and assist us in really caring for these individuals who are counting on us to bring to them the best treatments available. So for instance, we have tremendous administration support. Our dedicated oncology nursing team is very much involved in the care of the patients. We utilize heavily our nurse navigation program as a way to be a liaison between our medical team and the individual patients that we're caring for. And they take an active role in helping render some of the decisions that we make while we're in tumor board. Our social work service team is also very much involved in our tumor boards, rehabilitation, nutrition, and our survivorship programs as well. So working together with these individuals, we have been able to care for some very complex medical situations right here at Calvert, and then utilize our partners outside of here for certain situations that require a little more assistance and specialty.
Speaking of that partnership, one of the ways in which this affiliation with the Duke Health system has enhanced our tumor boards is that we have participation from specialty-specific experts in the various cancers coming to to join our conferences on a regular basis and helping to further discussion, to shed light on cutting edge managements that might be available, and to provide additional expertise to the milieu of the conversation.
Yeah, they have been a tremendous asset to our tumor boards and the way we help our patients. Interestingly, we have just initiated our clinical trials program, and we're doing that in collaboration with the Duke Cancer Network. And one of the neat opportunities we have is to be able to utilize some of that molecular testing information that we directly obtain on our patients in sharing that information with the Duke physicians and seeing if our individual patients have opportunities for clinical trials. So having the partnership with Duke, it really has been a huge boon for our patients.
And they don't even have to go all the way down to North Carolina to get that anymore.
No,
so,
unless of course they want to.
Unless they want to. So. Cancer care has evolved and improved so significantly. I mean, I think back over the course of my now close to 30-year involvement in oncology, and all of the changes that I have seen personally. There's no question that people with a cancer diagnosis are living longer, are living better, and our survivors are growing leaps and bounds all the time. One of the downsides, if you can call it that, of survivorship is that there's an opportunity for other problems to start to crop up. And we recognize that not only are these related to the mere aging, simply by surviving, living longer, you continue to have risks for developing other diseases such as cardiovascular health problems and things of that nature. But many of our treatments also can have an adverse impact on some of these risk factors as well too. So one of the most important things that comes through getting a patient successfully through his or her treatment is kind of the next steps. How do you move on? How do you improve upon your current risk factor profile, enhance your overall life? How do you minimize, to the extent possible, the risks of other problems developing?
Well, you hit the nail on the head, so to speak. Really, if you look at the most recent statistics, there are about 18 million cancer survivors today. And the reason why it's so important for us to understand and address the issues that come up during cancer survivorship is exactly what you said. We are doing a better job of allowing our oncology patients to live and survive and thrive for much longer than they have ever been able to. If you look at the statistics nowadays, the survival of cancer has improved dramatically over the last 10 years. And unfortunately, there are also newer numbers of cancer diagnoses in younger patients. So that population continues to grow and expand. In terms of caring for those individuals, our NCCN guidelines define cancer survivors as any individual who's been diagnosed with cancer from the time of diagnosis throughout that continuum that you were talking about. And those could be people that are cancer-free or even in active cancer treatments. What we do know is being diagnosed with cancer and being treated for cancer has tremendous impact on a person's quality of life and how they feel. And those aspects not only affect them physically, but mentally, emotionally, socially, financially, professionally, psychologically. And so, fortunately for us, there are some really helpful guidelines on how we care for those survivors. So, one thing, as you pointed out, is we're always making sure we're helping those individuals reduce the chance of developing other cancers or new cancers completely unrelated. So that is going to require us to be very mindful about how often we do surveillance studies, blood work, evaluations, CAT scans, PET scans, nuclear scans, and the likes. We're also making sure we're doing everything to prevent their health from worsening, whether it's a recurrence of the cancer or helping them live with the cancer. So those strategies are things like medications, for instance, hormone blockers, immunotherapies, even chemotherapy, or other ways to keep cancers at bay or allowing them to enjoy their life while dealing with being a cancer survivor. There is a lot of research over the last couple of years that talk about certain lifestyle modifications that can really help enhance a person's quality of life as a cancer survivor. And in talking together, it would seem sort of intuitive, but when you're going through cancer survivorship, sometimes it's hard to know what to do and what not to do.
Sure.
So these are things that are fairly, seem simple, but hard to do every day. Things like healthy eating, okay, portion control, quality, quantity, timing. They call it the clean diet, which is minimizing things that are not necessarily nutrition rich, like cookies, candies, cakes, chips, sodas, fast foods, alcohol. But the truth is, it's finding something, a balance that's sustainable and enjoyable. The other strategy is physical exercise and maintaining a variety of exercises. So cardio, weights, stretching, and one size does not fit all. I know you're very active and care for yourself physically, but I always encourage people to try different exercises and see what works for them. The guidelines are 150 minutes a week. So it seems like a lot, but you can break that down into 30-minute chunks a couple times a week. And then things like integrative health, stress reduction, sleep, relationships, just self-awareness, spirituality, different ways that you address anxiety, stress, distress, loneliness, grappling with health situations that are difficult to control. Those things do make a difference.
One of the most important messages I think you're communicating is that a cancer diagnosis is not an end-of-life thing by any means. That, in fact, it can just simply be the first step on the way to better living. I mean, lifestyle changes are always difficult no matter what, but perhaps there's a greater incentive to pursue some of those things, having, if you'll pardon the cliche, dodged one bullet.
Yes, it's very motivating to have a cancer diagnosis. Yes, I think you and I and our whole team not only want our patients to do well and to tackle the hurdles that they're facing with their oncology issues, but also to find a way to thrive.
That was the word I was going to use.
Yeah, and enjoy, and maybe get back to doing the things in their life that they've always enjoyed. Maybe even have that incentive to do a little more for themselves than they had before their diagnosis.
Well, anticipating in future such discussions, we will probably want to dive a little bit more into the specifics of some of these risk factors and risk reduction therapy. I certainly look forward to continuing these conversations. If individuals who are seeing this this program today are interested in pursuing this, if they have other questions, how do they reach us?
Yes. So really we've developed on the Calvert Health website the cancer care section, and that is a great resource for people in our community and our patients to look at and find information about our team. There is a section on nurse navigation. As I mentioned, the nurse navigators are really the liaison between the community and our team. So I would believe that's usually one of the most effective and efficient ways to get in touch with us. Of course, we're here 5 days a week, so someone can always call our office to reach us. And we not only have our medical oncology group, but we also have the breast health team as well as the high-risk thoracic team. So we have different clinics, if you will, to serve the patient's needs, and they can also look into those other resources.
Very good. Very good. Any concluding thoughts?
Well, I would say that I feel like our team works together so well and takes tremendous responsibility for the work we do. It's such a pleasure to work with you and our teammates. And I feel confident that if someone in the community trusts us with their health, we will rise to the challenge.
Very good. Well, once again, my name is Dr. Kenneth Abbott.
And I'm Dr. Arti Patel.
And we thank you very much for your attention.